Hello. Today we're here to talk about something very important for many of our patients: inhaler devices. A patient with asthma has questions about its use. This scenario tests your ability to communicate clearly, demonstrate practical skills, and provide patient-centered care. Good luck with your OSCE preparation.
Hi, I picked up my new medication, the Flovent Discus, from your pharmacy yesterday, but it seems empty. There's no drug inside.
Hey there. I'm Farah, the pharmacist on duty today. Please, have a seat in our counseling area.
Thanks, I appreciate it.
Can I have your name and age, please?
Sure, it's Ryan Edward, and I'm 38 years old.
Great. Thanks, Ryan. Now, can you show me how you were instructed to use this medication? Did the pharmacist explain it to you?
Yes, he explained everything clearly, and I even tried using it in front of him.
Perfect. Just to confirm, what condition are you taking this medication for?
I have asthma.
Got it. Is your asthma currently well controlled?
Not really. That's why my doctor prescribed this new medication.
Understood. I see here in your profile that you're also using a Ventolin inhaler.
Yes, that's right.
How often are you using that?
I take 2 puffs 4 times a day when needed.
Got it. Are you confident you're using them with the right technique?
Yes, every time I come to the pharmacy, the pharmacist confirms that for me.
Okay. And have you experienced any side effects from the Ventolin medication?
No, nothing at all.
Okay. Thank you for the information. Would you mind giving me a couple of minutes to check my reference?
Sure, take your time.
Thanks so much for your patience. I know it can feel a bit overwhelming, but I'm here to help. So, the Flovent Discus is a really effective inhaler that delivers medication in a fine powder form. It's actually pretty cool because it's a breath-activated device. This means that when you take a deep breath in, the medication is released automatically.
Oh, I see. That sounds different from what I'm used to.
Exactly. When you inhale quickly and deeply, you might not feel the medication going in, and that's totally normal. It's designed that way. After you take your dose, there's a handy dose counter on the side that will show you how many doses are left. Once it gets down to 5, it'll turn red to let you know you need to refill soon.
That's helpful to know.
I'm glad to hear that. Just remember, unlike the Ventolin inhaler you might be familiar with, you won't feel the medication coming out of a canister with the Discus. This medication is really important for keeping your asthma under control, so it's essential to use it regularly, even when you're feeling good.
Okay, that makes sense.
Also, after you take your dose, be sure to rinse your mouth thoroughly to prevent any fungal infections, since this medication is a corticosteroid that works locally in your airways. Does that all sound clear?
Yes, it does.
If you find you need to use your Ventolin more than 2 times a week, especially at night or within 6 hours of using it, definitely see your doctor and keep your vaccinations up to date.
Will do.
And here are some non-drug tips to help manage your asthma. For starters, keeping your environment clean can really help reduce allergens. And remember to exercise regularly, but try to pick activities that don't trigger your asthma. Eating a balanced diet rich in vitamins can make a big difference too. And of course, it's crucial to avoid known asthma triggers whenever you can.
Thanks, I'll definitely try those out. I appreciate the advice.
Before you leave, I want to give you this pamphlet. It's an action plan for self-management. It's really helpful. It lays out clear steps for managing your condition. You'll find guidance on what to do if your symptoms worsen, how to use your medication properly, and when it's time to seek medical help. It's kind of like having a personal guide, just to ensure you're taking the best care of yourself.
That sounds good, thank you. I feel a bit more confident about handling this now.
I'm really glad to hear that. Remember, you're not alone in this. If you ever have questions or concerns, just reach out. We're here to support you.
I appreciate that, it means a lot.
Of course. Can we give you a call in 2 to 3 days to check in and see how you are doing with the medication?
Sure, that would be great. Thank you, Farah.